Hi, my name is Roxanne Taylor, and I am the Living Donation Coordinator for the Maine Transplant Program at Maine Medical Center. We are here to help you through the living donation process. A person must have normal kidney function to be a living donor. We measure kidney function by a test called creatinine clearance. Your creatinine clearance must be 80 or above to meet our criteria. You will lose 50% of your kidney function on the day of surgery, but by 3 months post-surgery, you will get back to about 70% function. That is plenty of function to keep you in good health. Most people don't start to have symptoms of kidney disease until they are under 30% of kidney function. Besides being a good physical condition, there are other requirements to being a donor. You have to be mentally competent, able to make your own decisions, and no one should be forcing you or leaning on you to make this decision. It's a federal law that you cannot be paid to give up a kidney. You should be in a stable social situation. You have to fully understand what you are getting into and what the risks and benefits are to you, and you need to understand why you are doing this for the recipient and how it will affect them. There are some simple, straightforward benefits to you. You will get a very comprehensive assessment of your health for free. You will also get the satisfaction and psychological benefit of improving somebody else's life. There are significant risks to living donation, though, as well. Let's look at 3 broad groups. First, there's the risk of surgery. We'll go over these in more detail in a minute. Second, there are the risks of giving up a kidney and living your life with just one. This is an area that's a little more complicated, but we'll go over these issues in more detail too. Lastly, there are other additional risks. These include scarring from the surgery and how it affects your body image, as well as the risk of post-surgical depression. This is most common if you already have a history of depression, but it can happen to anyone. Pretty much everyone understands that there are risks to surgery. There is a long list of potential complications, as you can see here. Fortunately, most of them are quite rare, but there are people who have died or sustained serious injury as a result of this operation. You will receive more detailed information about the surgery when you meet with the surgeon, and we will have another presentation specifically about the surgery that you can access on the website as well. Living donor nephrectomy, or removal of a kidney, even though it is done laparoscopically with small incisions, is still a big operation. The most complicated area to understand is whether there is any long-term systematic health risk to living with one kidney. In long-term studies of donors, we know that donors live as long or often longer than the general population. However, donors are healthier than the general population. They don't have diabetes or hypertension or obesity because those problems would have ruled them out. We know from studies that the rate of kidney failure in a donor is the same or lower than the general population. But again, if you compare the rate of problems to people as healthy as donors, there probably is a small increased risk of kidney problems. We know that 85% of donors will actually end up with normal kidney function, as the remaining kidney gets bigger and filters more blood. But still, you are giving up your backup system. Lastly, there are no lifestyle limitations and no activity limitations once the donor has recovered from the surgery. There are some medications that we want you to be very cautious with, and you should always alert medical personnel to the fact that you are a kidney donor. There are financial things to consider as well. As far as medical insurance and the direct costs of the procedure, you are covered. You can't have medical insurance denied to you in the future because you are a donor. That's the law. It's the recipient's insurance that is responsible for the costs of the testing, the surgery, and anything that happens in the immediate postoperative period. However, that doesn't mean that there aren't other financial consequences. There are some indirect costs of being a donor. such as the cost of travel. Although there are some income-based grants available through an organization known as the National Living Donor Assistance Center, you won't be reimbursed for your time out of work. Post-operative pain medication cannot be covered by the transplant program, but can be submitted to your own insurance. We recommend that if you do not have life insurance and you wish to purchase it, you should do so before the surgery. So why do we even ask people to become living donors? Well, lots of reasons. We'll talk about the benefits of living donation to the recipient over the next couple of slides. But this graph shows the total number of kidney donors in the United States. There are about 100,000 people waiting for a kidney in the U.S., and the graph clearly shows that there aren't enough deceased donor kidneys to go around. About 40% of all kidney transplants come from living donors, and without those living donors, everyone needing a transplant would have to wait on the deceased donor list. Without living donors, the wait time for a kidney would jump to 10 to 15 years. Here are some benefits of living donation to the person receiving a transplant. The transplanted kidneys do not last forever due to medications and other possible medical issues in the recipient. Most important, the living donor kidneys work longer. Living donor kidneys work on average almost 50% longer than a deceased donor kidney. In addition, recipients can get off dialysis sooner or even avoid it entirely. The average wait for a kidney, depending on blood type, can be up to 5 years in Maine. Living donor kidneys generally work right away, so the hospitalization is less. Sometimes we can use less anti-rejection medication with the living donor kidneys, and most all outcomes are much better with living donor kidneys. It should be pointed out that a living donor transplant still carries risks to the recipient, even if they are less than with a deceased donor kidney. The recipient still can get side effects from the anti-rejection drugs. Just keep in mind, the average living donor kidney will last 12 to 15 years. One thing we really want to make clear is that you can change your mind at any time. Becoming a living donor is a process, and we understand that people are different, and there may be different situations that come up during that process. It is never too late to change your mind. We also want to make it clear that we are your medical staff and these are your medical issues. We will never discuss your evaluation with anyone except you, unless you ask us to. That is true, no matter who your intended recipient is, a friend, a family member, or even a spouse. Even if you change your mind in the middle of the evaluation, all we will tell anyone is that you didn't qualify to be a donor, period. The path to becoming a donor consists of 7 steps. First and most important is for the potential donor to step forward and to consider being evaluated. From there, we will go to the screening phase. This is where we will review the health questionnaire that you filled out and closely review your medical records. We look for high blood pressure, problems with blood sugars, blood in the urine, and past kidney stones, among other things. Any of those conditions would make you ineligible as a donor. However, even if you aren't medically able to be a donor, you may still be able to help your intended recipient by being an advocate to help them find a medically suitable donor. If you are interested in this, just contact us at the Transplant Center. The next phase is for those who are still eligible, and it is the testing phase. If you are from the local area, we may have you come to the office to meet some of us. We can go over this process in even more detail, and we'll start some blood testing. If you are from away, as we say in Maine, we'll start this process virtually with a combination of electronic and phone encounters. It is through the testing phase where we can determine if you can be a direct donor or if it would be better for you to enter a kidney exchange program. To donate a kidney directly to another person, you must be what we call blood type compatible. The rules are the same as in giving blood. Some people with certain blood types, such as O, can donate to anyone. That is why we call people with O blood type the universal donor. People with other blood types like A can only donate to others of the same blood type. This chart shows who can donate to the recipient depending on their blood type. The second requirement for direct donation is cross-match testing. In this test, we are testing how the recipient's immune system will react to the donor's DNA in the kidney. When a person receives a kidney transplant, the cells of that kidney contain the donor's DNA. So for this testing, you as the donor give blood, and it's treated and mixed with the recipient's blood to see if the recipient's immune system reacts to your DNA. This predicts the likelihood of rejection of the kidney within the recipient, and there can't be any sign of a reaction for the transplant to move forward. Until recently, the only way to do living transplants was through direct donation. However, we have now developed national systems, or what are called kidney exchanges or paired kidney donations, so that even if you can't directly donate to your loved one, you can still donate a kidney that ends up getting your intended recipient transplanted. In fact, even if you are eligible to directly donate a kidney to your loved one, it can sometimes be a better advantage to enter into the kidney exchange in order to get your recipient an even better kidney than you could donate, such as a better matched. You would also have the opportunity to help other people get transplanted. The way this works is that there is a national registry of all the donors and the intended recipients who are not eligible for direct donation. And a computer will look at all these pairs and come up with ways to get some of them transplanted. Let's look at an example. This is a very simple example of how a kidney exchange works. Let's say we have a donor and a recipient in Maine. The donor is an A blood type and the recipient is a B. If you remember from one of the previous slides, that's a problem. An A blood type can't donate to a B blood type. There would be a reaction that would destroy the kidney. Now let's say there's also another donor and recipient pair in Maryland. This time the donor is a B and the recipient is an A. Well, that won't work for direct donation either. What a kidney exchange does is to realize that if we put these two pairs together, the donor from Maine can give to the recipient from Maryland, and in exchange, the donor from Maryland can give to the recipient in Maine. Two transplants have now happened that otherwise wouldn't have. Now this is the simplest type of an exchange. In fact, you can have long chains and much more complicated arrangements. But even the most complicated arrangement is a version of this same simple theme. The other tests in the testing phase include urine tests and other blood tests. We'll get a 24-hour collection of your urine, which gives us the most accurate measure of your kidney function. That's that test we talked about in the very beginning, the creatinine clearance. We'll also get some routine blood work. We'll test for urine infections, and if there's a family history of diabetes, we will look for signs of pre-diabetes in you. Once you finish with the testing phase, we move to the evaluation phase. We will have you come to the transplant center. That may be a repeat visit for some who are local, but even people from far away need to plan on coming for this visit. At this visit, there will be even more education with your transplant coordinator, and you will meet with our entire transplant team. You'll meet with a social worker who is trained to help you with any adjustments to your outside life that are necessary around the time of donation. You will meet with an independent donor advocate, a person not part of the transplant team, whose job it is to represent you and you alone in the system. There will be a visit with a dietitian, a financial counselor, and a pharmacist will look over your medication records to make sure you are not taking any medications that could impact your kidney function. Lastly, you will meet with both a kidney specialist and a kidney surgeon, either Dr. Palmer or Dr. Whiting. There is also usually more testing at this point, including some special blood tests looking for infections, a TB test, an EKG, a chest X-ray, and then lastly, imaging of your kidney. The images that we get of your kidneys are usually the last step of the evaluation. Here is an actual picture of someone's kidneys. We want to know about any abnormalities, and these images both complete the testing for your evaluation as well as provide a roadmap for the operation. We'll talk more about the actual procedure and hospitalization in that second presentation. At the evaluation visit, we are also required by law to discuss whether you might engage in what is considered high-risk behaviors by the National Public Health Service. These are obviously sensitive conversations and your confidentiality is strictly protected. However, we need to tell you that if you do answer yes to any of these questions, we are required, again by law, to disclose to the recipient that they might be at higher risk for developing an infection should the transplant go forward. Once all of the testing and the evaluation is done, and all of them show that you are eligible to be a donor, all of the information is put together and the whole team reviews the results and discusses your candidacy. This is how we assure that everyone has a say, that all of your needs are representative, and that no problems can slip through the cracks. It assures the safest experience for you. Our goal is to complete all of the screening, testing, and evaluation process within 4 weeks. But if you feel a need to go slower, that's okay too. However, we feel we owe potential donors a quick evaluation and decision if that is what they desire. Only after all of the evaluation is discussed and you are accepted in this meeting will we then start discussing potential surgery dates. We hope that you have found this presentation educational and enjoyable. Becoming a donor is truly an amazing experience, and you will literally transform another person's life by doing so. It is worth saying that there is nothing you can do to improve your kidney function. It is what it is. What you can do is to be proactive in this process. We are always happy to hear from you, and we will work hard to help you overcome any obstacles. The best thing you can do is to lead a healthy lifestyle and get this process started. If you haven't spoken with someone from the donation team already, you can give us a call at 207-662-5058, or better yet, download the health history, the living donation evaluation consent, and the medical record release to allow us to get your medical records. Send those forms to us and we will get you started on the road to becoming a living kidney donor.